Chair Nelson and members of the board, departmental item number 1 is from the County Executive Office. It is a hearing to consider recommendations regarding an update on the coronavirus disease 2019 COVID-19.
Good morning, Chair Nelson and members of the board. Madam Clerk, may I have my slides? Next. This morning's briefing will cover the blueprint metrics, our current vaccination efforts, and our latest quarterly report on COVID-19. Next. We anticipate that at noon, it will be announced that our adjusted case rate for this tier assignment will be at 4.6. Unadjusted, that would be from a 5.1. Our testing positivity rate is at 1.6, with testing positivity rate in the health equity metric at 1.9. Next. Regarding vaccination efforts, 47.1% of Santa Barbara County vaccinated is the percent of total county residents who have received their first or single dose of the COVID-19 vaccine. The other portion of this percentage includes people who have not received any vaccine. So the rest of the story is, since 47% of the Santa Barbara County population has received at least one dose of the vaccine, then it remains that 53% of the population has not received any vaccines. Vaccine appointments are widely available throughout our county, and many of these clinics are now offering walk-ups. The full list of clinics is available on our website at publichealthsbc.org or via MyTurn app or calling 211. 33.3% of Santa Barbara County fully vaccinated is the percent of county residents who have received their second or first dose of COVID-19 vaccine. 41.5% of eligible Santa Barbara County is fully vaccinated. This is the percent of eligible persons currently age 16 and older who have received their second or single dose of the COVID-19 vaccine. Next. We have an abundance of vaccine appointments and are also experiencing a decrease in demand. As such, we flex the number of vaccines that we are ordering on behalf of our healthcare system. So for distribution for this week, May 10th, Cottage Hospital is getting 4680 of the Pfizer. Our remaining network providers will be getting 4,200 of the Moderna, 1170 of the Pfizer. The public health pods, or otherwise known as the mass vaccination clinics, will be getting 400 of the Moderna. And again, this is really driven by the vaccines we still have in stock in our refrigerators or freezers. So the total first doses we will be getting is 10,450. With regards to second doses from our TPA, we are getting 7,780. The HRSA totals stand at 900, and you can note that this number is much lower, and that is because we are finishing up our HRSA equity vaccination clinics, with the second shot clinics being in Santa Barbara this week. So after we are done with these community clinics, our community healthcare centers will resume offering vaccine appointments on a smaller scale at the 5 healthcare center sites, which is in Santa Maria, Lompoc, Santa Barbara, at the Franklin Community Center, and in CARP. Next. I'd like to share with your board our mobile vaccination clinics. And we started these mobile vaccination clinics on April 15th. So during the first week, we were able to offer 1161 vaccine appointments, week two, 1,037, and week three, 1,055. So altogether, through the mobile clinics, we have offered 3,253. This was done over 39 clinics in partnership with various community organizations and groups. For this week, we have 15 clinics planned. A list of the clinics, which again will offer walk-ups, is available on our website at publichealthsbc.org or 211. So we encourage community members to visit our mobile clinic locations if they are wanting a vaccine. Next. So this is another depiction of who we have been reaching via our mobile vaccination clinics. So the blue portions of each pie chart show that we have been really engaged with community partners, with growers, vaccinating the community in the ag sector, as well as at their work sites. Next, we also have been reaching out to community-based organizations, community centers, senior centers, and that is depicted in the orange of the pie chart. The gray represent faith-based. We started week one with about 8% of our total vaccination in the faith-based community, with week two at 28%. And week three, we are working with the remaining faith-based communities. What we're hearing is that a lot of the congregants have been vaccinated. We are also continuing to work with low-income housing and formerly unsheltered community residents, as well as supporting disability centers and addiction centers. We will be vaccinating 300 students at our mobile vaccination clinic at UCSB this Thursday. So this clinic will be on campus. And on Saturday, we will host a clinic at the Lompoc Outdoor Market with the Johnson & Johnson vaccine, and this is all walk-ups. On Sunday, we will have a walk-up clinic at the Goleta Community Center. We also have clinics in Carpinteria and Santa Maria with appointments and walk-ups available. And again, really wanting to point community members to our website for access to locations and where we will be basically every day. Next. And next, yes. So the quarterly report provides a high-level summary data collected by our public health department to help explain who is contracting the COVID-19 and how they're contracting the disease, where the transmission is occurring, and as well the demographics of the vaccine recipients and our progress to date reaching the county's most vulnerable population. So from January 2021 to March 2021, these are summary points for your board. Cases reach a pandemic peak early in January, followed by highs in hospitalization and deaths. All metrics then decrease through February and March. We found that working age adults age 18 through 49 years of age had the highest proportion of cases. We are finding that the cases were most common among the 20-year-olds. We are further finding that the Hispanic and Latino community members were disproportionately represented in COVID-19 cases, hospitalizations, and deaths. Santa Maria had the highest case count and the highest case rate. Most cases were symptomatic with 36% had close contact with a known case. 30% of Santa Barbara County residents received at least one dose. And again, the numbers are different because we're talking about January 2021 through March 2021. Um, and of that county population, 16% are fully vaccinated. During the first quarter, the HPI target areas, 20% of the population had received at least one dose of the vaccine, with about 10% fully vaccinated. The full report can be found on our website at publichealthsbc.org. And that concludes my briefing this morning.
Thank you, Dr. Dodo Reynoso. Any questions from the board?
Mr. Chair, just an observation.
Yes.
I think it's really important to, and I know Dr. Reynoso mentioned this, but these are numbers from the end of March. So I don't want people to be quoting those vaccination numbers. I think it's just important to spell that out again, that those numbers are considerably higher at this point.
Thank you, Supervisor Lavanino. Supervisor Hart.
Yeah, I just want to take this opportunity to really thank the Public Health Department for all the innovative ways that they're reaching out to get vaccines in people's arms. You know, the percentages that Dr. Dodo Reynoso described at the beginning of the presentation, I think 40% of all Santa Barbara County residents and 47% of the eligible vaccination population have been inoculated. And those are really outstanding numbers, particularly compared nationally to other places. But it does still point out that we have a challenge going ahead. The rate of vaccination is slowing. You know, our supply is dramatically increased to the point now where we have plenty of vaccine. There is really no reason for somebody to not be able to get vaccinated easily, simply. And so we have to get, I think, into the persuasion business and convince people that it's safe and important to do so. As we're beginning to reopen the economy and some of the really extreme measures are lessening, I think there's a natural tendency for some people who haven't been vaccinated to just sort of think, well, I can get by and it's not really going to be critical, but it is. And you know, we don't have to look very far around the world to see that this virus is far from contained. In India, you know, it's just the extraordinary video that you see of what's happening there is really not unimaginable here, given the still very large number of people who have not been vaccinated. So we need to persist and be persuasive. I was reading a New York Times article last night about some of the messages that seem to resonate with people who haven't been vaccinated. And it's complex because people are seeing this differently from different places. And I just encourage and applaud the work that the Public Health Department has done to make this accessible to everybody. The communications that you've created to tell the story and the urgency of this are really important. And it'll just get more difficult and more challenging and require more creativity to continue to extend that progress and make this, get us to that 70, 80% where we actually can achieve herd immunity. So thank you for your work.
Thank you, Supervisor Hart. Supervisor Hartman.
Yes, I'd just like to add that I'm now fully vaccinated, and it's such a relief to know that I'm not going to infect somebody and that I can plan my vacation this summer. And that I'm also doing my bit for the community as a whole, because everyone who gets vaccinated, there's a small percentage of our population that can't because of various health difficulties or age. And so when we get vaccinated, it protects others by reducing the potential for transmissibility. So get vaccinated. We still have to double our numbers, and we can do it. We're ahead, and we're, the emergency use authorization is replaced by formal FDA approval, more and more private sector enterprises will ask that you be vaccinated, and we may have a run on vaccines, so get it now.
Supervisor Williams.
Well, I want to first of all thank the department for attempting to address vaccine equity issues with sort of reaching out to the hard to reach populations, which I think some of those numbers show the significant effort that has been made to do that. I would like an analysis though of what demographics are vaccinated and what are not, so that we could, target that. You may already have that, but I want us to disclose that more to the public so that we might be able to really all do a better job to reach out to our friends, neighbors. I suppose my point is in strong agreement with Supervisor Hart's point. These are, if you compare them to other areas, these are great numbers in terms of how many folks are vaccinated. If you compare it with what we need to get to stamp out the pandemic, then they are wholly insufficient. So I think, number one, we need to challenge each other as human beings. I know many people have been busy. Many people have been waiting for their whole family to be eligible at the same time, but now is definitely the time to get vaccinated. It's very easy. There's very little crowding. Unfortunately, there's not enough people coming so that if you do come, you can get through real fast. But this kind of infrastructure, I'm sure, has an element of use it or lose it. I can't see all of the maintenance of effort taking place if we don't have people coming in to get vaccinated. And of course, it makes vaccine management more difficult because of the lifespan of some of these vaccines. I had the honor yesterday of getting to volunteer with some of your folks down at the Hilton yesterday. And I think they were trying to make me feel important by giving me a job of helping with vaccine management after I was starting doing greeting. But it gave me a window into the difficulties and the logistical things that you and your department go through. But I definitely think that all of us can do our part to get more people out and vaccinated. So I'm hoping that we could be provided with as detailed of demographic information about who is vaccinated and who is not as you have available.
Thank you, Supervisor Williams. My understanding is Dr. Doe Reynoso has a comment.
Yes, you saw my raised hand. Supervisor Williams, through the chair, on our website, we do break down the number of vaccination by race and ethnicity, by age, by gender, by region. So we have fairly detailed information on our website, and that is our one-stop shop for a snapshot of the latest information we have on vaccination, with regards to really being laser focused on who is left and removing barriers to those age groups or race and ethnicity or gender or region. That is why we have created the mobile vaccination opportunities and in concert with community partners. So we are continuing to work with a wide variety of businesses and faith-based communities and community leaders, just to make sure that everyone who wants a vaccine will have that opportunity to get it. We're making it super convenient by going to different communities, different locations, different hours, different days. So we have done, the team has done a fantastic job making vaccines accessible.
Thank you. Madam Clerk, do we have any public comment on this item?
Chair Nelson and members of the board, we have no requests to speak on this item.
Okay. I just have one further question for Dr. Doe Reynoso. What is the status, though, of the emergency use of the vaccine, and where are we at with full FDA approval?
That is a $1 million question. We did ask Congressman Salud Carbajal last week if he had any insights, and we know that Pfizer is intending to pursue full approval shortly, but it really is up to the FDA, and we don't have any further information on that. What we do know is that coming up shortly is that the FDA will give approval for Pfizer to be used with 12 plus and above. And so we will be quickly pivoting and planning currently on doing school-based clinics with partners to ensure that new age eligibility group will get opportunities to be vaccinated.
Okay, just to make sure I fully understand. Some of the talk about employer-based requirements or like the CSU or UC system, that's not going to go into effect until the federal, it's federally approved, and that's still
That is-
quite some time.
That is correct.
Okay, all right, thank you. All right, I'm not seeing any additional questions from my colleagues. Do we have any other further presentations from staff on this update? Not seeing any, I'd be willing to take a motion to approve the recommended actions.
Move A through C in our staff report.
Thank you, Supervisor Hartman.
Second.
Thank you, Supervisor Hart. Madam Clerk, will you please call the roll?
Supervisor Hartman.
Aye.
Supervisor Lavanino.
Aye.
Supervisor Williams.
Aye.
Supervisor Hart.
Aye.
And Chair Nelson.
Aye.
Motion passes unanimously.